I'm Dr. Karen Overall, and I'm going to show you how to do an adaptive collaborative exam with your dog and how to teach your dog skills they'll need to go to the vets. Why an adaptive collaborative exam? Quite simply, if dogs are more familiar with the behaviors that we're going to ask them to do in a veterinary practice and more familiar with the manipulations we ask them to engage in, they're going to be much more comfortable, and we're going to not need to restrain them, and they won't be scared. So the more that dogs can collaborate with us, can help us do their veterinary exam, the better off we're going to be. And the trade-off for that is we also adapt to some of their behaviors. So for this, we're going to use my dog Gabriel. This is Gabriel. Gabriel is a wonderful 2-year-old male Australian Shepherd who is gray and bald, and it's a genetic defect, but he has the most fabulous personality you can imagine. Obviously, no one wants to breed for this, and I ended up with him because of this. We're using him because you can see all of his body parts really well thanks to that genetic defect. So when I demonstrate this, I want you to remember that you have this 4-page handout that explains the steps of the exam, and that will help you do all of these behaviors that we're hoping to do with Gabriel. Okay, so the first thing you're going to want to do is you're going to want to have a mat. This is Gabriel's mat from his puppy class. It is yellow. Yellow and blue are colors that dogs can see, and one of the things that we recommend is using a mat so that the dogs are comfortable and they always have something familiar of theirs in the veterinary office. Gabriel, could you come over here? Could you sit? Gabriel, could you sit? Good boy. Okay, now, he's familiar with this mat. He knows about sitting. What do I want you to do as part of the physical exam? The very first thing I want you to do is exactly what I'm doing, which is I want you to look at the dog. I want you to hold them carefully, very gently. Gabriel has been taught to put his chin in my hand when I put my hand out, which is why he keeps doing this. And this is a great behavior to teach dogs, a nice chin rest. But you're going to run your hands down the back of the dog, all the way down. You're going to feel all of their skin on both sides. You're going to feel under their chin. And right now what I'm doing is I'm feeling for the lymph nodes that are under the chin. You're going to look in their ears and make sure there's nothing in there. You're going to look in their eyes and make sure they're clear. You're going to run your hands down the shoulders, and you can see that he's pretty bald, but he has no lumps and bumps. You're going to bring your hand down to behind his knee and feel for a bump on each side, because that's the other common lymph node that we worry about. Finally, you're going to look at his teeth. You're going to press on his gums. They'll turn white and then immediately pink up again. This is something that every veterinarian will do. You're going to look down his throat. If he'll let you do this, you're going to put your hands on either side of his chest so that you feel his heart rate, and you're going to gently feel his belly. Just put your hands on his sides, go all the way down, gently push on the belly. Now, our patients are often afraid of veterinary equipment because they're not exposed to it. You can buy a very cheap stethoscope on Amazon and do exactly what I am doing. You're going to go to where his elbow hits his ribs, and that's where we're going to place the stethoscope. And you don't have to listen for things. You can listen at the inlet of his throat. You can listen on the other side. You can listen to his belly, because if he has a problem with his stomach, this is something we'll do. Get them used to seeing and smelling and looking at the stethoscope. Finally, the thing that I want you to do is to take any good lotion. This happens to be a goat's milk soap. This is Eucerin. This is just an oatmeal lotion. And this is a lotion that has almost nothing in it except 3 or 4 ingredients. And I want you to take that lotion and put it on the front of their legs and rub it in. Why? Because when we take blood from your dogs, we're going to use lidocaine cream, okay? This is an analgesic cream that will help numb the skin, and any of these lotions will mimic what it feels like to have this put on your dog. So you're going to want to rub it in, and you're going to want to manipulate your dog's leg. Very often we hold off a vein, and you can probably see the vein right here. If your dog is used to having a numbing cream put on them, and they're used to having the vein held off, none of this will bother them. Finally, what I want you to do is manipulate your dog's feet. Gabriel, stand up. Come on. Stand up, please. Stand. Come on. Up. Okay. When you put the cream on the back, I want you to put it in this region. And when you practice picking your dog's feet up, turn their toes upside down. That's the first part of a neurological exam, and it's something we do with every dog. The last thing I want to talk about is brushing your dog's teeth. Gabriel loves to have his teeth brushed because he loves the flavor of the toothpaste. We're beginning to get rained out of this session, so we'll finish very quickly. Gabriel, come here. When you go to brush your dog's teeth, use dog toothpaste and just cover the toothbrush and gently brush their teeth inside and out. He's been having this done since he was a few weeks of age, so he's great at it. If your dogs will not let you use a toothbrush, consider a washcloth and do the same thing with it. That will allow you to clean your dog's teeth. Now, why do we care about this? Because the second you cannot do this, if you've been able to do it, you have a problem and you need to see your vet. That's the basic adaptive exam with collaborative care for dogs. Gabriel's a star and we're rained out, so that's our first demonstration.